Dysphagia as a result of treatment in cancers of the head and neck. As a result of this presentation, learners will be able to differentiate the types of treatment of head and neck cancer, as well as explain how each treatment can cause dysphagia. Dysphagia is a common result of treatment of head and neck cancer. It is characterized as difficulty or discomfort when swallowing. Patients with cancer of the oral cavity, pharynx, or larynx will often undergo one or more treatments, including radiotherapy, chemotherapy, or surgical treatment. First treatment modality we will delve into is radiation treatment. External radiation is a cancer treatment which uses radiation exposure to shrink tumors and cancer cells. Radiation has both early and late side effects which may impact swallowing abilities. Early radiation effects which can influence swallowing is xerostomia, or dry mouth influenced by lack of saliva flow, erythema, which is redness caused by irritation, superficial ulceration, which are open sores which can be painful and slow to heal, bleeding, pain, and mucositis, which is the painful inflammation and ulceration of the mucous membrane. Late radiation effects include osteoradiogenecrosis, which is bone death as a result of radiation, and that affects the lower jaw and mandible. Trismus, or lockjaw, which influences limited range of motion, altered oral flora, which can lead to tooth loss and impair mastication, dental caries or cavities, which again can cause discomfort, and altered taste sensation, which can make eating and swallowing. The next treatment type is chemotherapy. Chemotherapy is a drug-based treatment used to kill fast-growing cancer cells. Common symptoms of chemotherapy include nausea, generalized weakness, which can influence the swallowing abilities, fatigue, anorexia and weight gain, mucositis, which is sufficient pain which requires non-oral supplementation. A common result of mucositis is impairment to mastication and swallowing, and stomatitis, which is a chemotherapy-related oral cavity ulcer which makes eating difficult. The last treatment type we will discuss is surgical treatment. Cancers of the head and neck cavity can range from size, location, and severity. Surgical treatment involves removing part or the entire cancerous tumor from the body. Surgical treatment in the pharynx, involving the pharyngeal wall, vallecula, and piriform sinus, can cause negative effects on swallowing. And an example of surgical treatment is a tumor located in the posterior oral cavity, including the base of tongue and soft palate, will often result in more severe dysphagia. Now we will discuss treatment implications and effects on swallowing. So radiation, chemotherapy, and surgical treatment can all have direct and negative impacts on swallowing function. Radiation exposure can cause the muscles and mucosal lining of the throat and esophagus become stiff, deformed, and often lead to painful swallowing. Chemotherapy can cause mucositis and stomatitis, which can cause pain, and oral cavity ulcers, which make eating difficult. And surgical treatment can lead to increased oral prep time, increased oral residue, along with pharyngeal transit time, difficulty clearing the bolus from the pharynx, and severe post-surgical aspiration. Following treatment of head and neck cancer, it is extremely important to begin the rehabilitation process to treat the results of dysphagia. Following a modified barium swallow study or a video fluoroscopic evaluation, rehabilitation techniques to treat the swallow disorder may include postures, maneuvers, exercises, and diet modifications. An example of a posture used to help treat a swallow disorder is a head tilt, and this is where the head is tilted towards the strong side to keep the food on the chewing surface. An example of a maneuver includes the Mendelssohn maneuver, and this is designed to elevate the larynx and open the esophagus during the swallow to prevent food and liquid from falling into the airway. And during this maneuver, the patient holds the larynx in an elevated position at the peak of the hyolaryngeal elevation. An exercise example is lingual isometric exercises. The patient is provided lingual resistance across exercises to increase strength. Diet modifications may include modification to the texture of food to make swallowing safer or allow for oral intake. And this can include changing the viscosity of liquids or softening, chopping, or pureeing solid foods. So what's the SLP's role in all of this? It is the speech-language pathologist's role to reinforce oral care procedures with patients suffering from swallowing impairments as a consequence of treatment of head and neck cancer. And to wrap up this presentation, we will just briefly discuss some statistics and treatment outcomes. Post-treatment dysphagia occurs in approximately 50 to 60% of head and neck cancer survivors, although it's suggested that this incidence is underreported. Risk factors for dysphagia among patients with head and neck cancer include stage of cancer and type and duration of treatment. Deciding which cancer treatment is best can take time and should be discussed with a doctor. It's important to learn about all treatment options and the implications which may occur as a result in order to make the best decision that is best for the situation. Thank you.